Hello, welcome to Point of Care Nurse. My name is Gozi. Today we're talking about acute peripheral vascular insufficiency. Basically, it's lack of blood flow to the peripheral parts of the body. It usually majorly affects the legs and the brain. For the portion that affects the leg, that will be peripheral arterial disease. Let's start with that. So, peripheral arterial disease is a condition that usually affects the legs. And in this case, there's usually reduced or no blood flow to the lower extremities, the legs. Um, some symptoms of this condition is pain. The patient might feel pain of different intensities. It might be mild, it might be severe, depending on how severe the blockage is or how severe the lack of blood flow to the leg is. Another symptom is pallor, some kind of discoloration. So, depending on the ethnicity of your patient, the patient's color in the extremities may vary from pale to mottled to dusky to necrotic even. Um, Absent pulses or diminished pulses is one big one. So usually, I think the two big ones for me are temperature and a lack of pulses. So if I go to assess my patient, I feel their extremities, I touch their hands, I touch their legs, like their shins, and I touch their feet. And if one foot is cold and the other one is warm, and I'm like, so, I check for pulses. I can really feel the pulse on the cold one, but I feel it on the warm one. I'm like, I can feel the pulses. I check, and feel it. I grab a Doppler, put some gel on it, look for a pulse all over the place. If I can't find a pulse, most likely a patient like that has peripheral arterial disease. So I think the two big things are temperature. You feel the foot is cold. You check for a pulse. There's no pulse, or there's diminished pulse. It's like a very weak pulse. Those are, I feel like, the first two big symptoms that it's easy to remember and easy to actually do. So we talked about pain. We talked about pallor, discoloration in the area. We talked about pulse, absent pulses or diminished pulses. Paresthesias, they might feel pins and needles in the area due to a lack of blood flow. Paralysis is another one. They might not be able to move the limb as much as they usually do, so they might have totally no movement or limited movement in the area. Another symptom is poikilothermia. So in this case, the patient may have loss of hair in that area. The area might be thin, shiny, glossy. Um, it's a sign of chronic PAD, this poikilothermia. Again, I said this before, the area might be cool to touch and there might be some mild edema in that area. So these are the signs of peripheral artery disease: pain, at rest, even when the patient's not doing anything, the area is hurting because there's no blood flow. Pallor, discoloration, pale, mottled, dusky, necrotic, depends on the patient's ethnicity and how severe this condition has become. Absent pulses or diminished pulses, paresthesias, paralysis, poikilothermia, lack of hair in the area, shiny, thin skin, and cool temperatures. The ankle brachial test The ankle brachial index is used to test for peripheral arterial disease. So basically, it's uh, the brachial blood pressure and the ankle blood pressure are taken. The ankle blood pressure is divided by the brachial blood pressure, and the normal value should be greater than zero point 0.9. So for the test, you need to know this value greater than zero point 0.9 is the normal ankle brachial index when you're testing for peripheral arterial disease. So ABI, ankle brachial index, greater than zero point 0.9 is normal. You only need to remember this for the exam. Greater than zero point 0.9 ABI. I hope that little limerick will help you to remember. Now we're going to talk about um, diagnostic testing for peripheral arterial disease. So usually it's imaging of some kind. So you can have Dopplers, ultrasound Dopplers done on the area to assess blood flow to the area. You can also have an arteriography done to assess blood flow to the area. Now, treatment or management for peripheral arterial disease is an embolectomy. So if the occlusion is being caused by an embolus, it's removal of that embolus via an embolectomy. You could do bypass grafting, which is creating another avenue for blood to flow to that area. And you could also do angioplasty, which is where you go in with a kind of like a balloon, and you go in first with the balloon deflated. You go into the area that's occluded, and you open the balloon and push whatever is occluding that vessel, push it flat in a sense, and then take out the balloon. So that is balloon angioplasty for peripheral arterial disease. Now, the patient, when they're in bed, should be in reverse Trendelenburg. Now, we shouldn't elevate that leg, because when you elevate it, it's harder for blood to flow to the area that's already lacking blood flow. So you want to do reverse Trendelenburg. So head up, feet down. Then medications for this condition obviously are thrombolytics. You want to break down thrombus if that's what's causing the occlusion. Anticoagulants, you want to make it difficult for any clots to form if this patient is prone to that. Also, antiplatelet agents and vasodilators to increase blood flow. So, again, medications for peripheral arterial disease are thrombolytics, TPA, anticoagulants like heparin, antiplatelet agents like aspirin and clopidogrel, and vasodilators as well. Now, we're going to talk about how acute peripheral vascular insufficiency affects the brain. It does that via the carotid arteries. So, here we'll be talking about acute symptomatic carotid artery disease. So, in this case, the carotid arteries are occluded, so blood flow to the brain is impaired. Now, signs and symptoms of this condition are TIAs, transient ischemic attacks. So, because of the lack of blood flow to the brain, the patient might start having mini strokes or stroke like symptoms. Patient might complain of visual disturbances, monoocular visual disturbances. The patient might be aphasic, have difficulty speaking or formulating their words. The patient might also actually have a full-blown stroke. We talked about a TIA before. Now we're talking about a stroke. So TIA is like a transient stroke-like symptoms come and go. In a full-blown stroke, they have stroke-like symptoms, and the symptoms are there obviously and kind of not going away. They're staying. So that's a full blown stroke. To test for acute symptomatic carotid artery disease, the patient will likely get a full stroke workup. So the patient will have CAT scan done, CTA. The patient will have an MRA done, like an MRI with contrast. CT is also a CAT scan with contrast. Patient might have carotid duplex ultrasound done to check for blood flow. The gold standard testing for acute symptomatic carotid artery disease is an angiography, but the patient is at risk for a stroke during the exam. This risk is because during the process of angiography, which involves insertion of a catheter into the occluded vessel, whatever is occluding that vessel might get dislodged and travel to the brain and cause a stroke, or there might be like dissection in the local area where the catheter is, dissection in the vessel that the catheter is in. So that's why we have a risk of stroke with the angiography, even though it's the gold standard for testing for acute symptomatic carotid artery disease. Treatment for this condition for acute symptomatic carotid artery disease is carotid endarterectomy, which is where um, the practitioner goes in and removes whatever is occluding the vessel from the walls of the vessel. We also have carotid stenting, where a stent can be placed in the vessel to keep it open and patent. And we can also give aspirin to the patient, as well as statin therapy to reduce the patient's cholesterol and hopefully reduce deposits on the vessels of the patient. After treatment and even after something like angiography, you want to monitor the patient. You want to do frequent neuro and motor checks to make sure that there are no further neurological deficits if it was already there, and if it wasn't there already, you don't want the patient to develop any without catching it quick. And also remember, angiography has a risk of stroke. So the patient needs to be monitored and have neuro checks done after that procedure, also after treatment. The patient also needs to be monitored blood pressure wise, heart rate wise as well, because the patient may have high or low blood pressures, high or low heart rates, hypertension, or hypotension. We need to monitor for the patient for bleeding. As with any surgical procedure, bleeding is always a risk, so we need to monitor the patient for that. The patient will also have symptoms of low perfusion, hypoperfusion syndrome. Patient might have a headache ipsilateral to the area that has been revascularized, which is on the same area. Ipsilateral is on the same area. Contralateral, opposite area. So if the patient had a stent placed in the left carotid artery, you want to watch for hypoperfusion syndrome by looking out for a headache on the left side. You want to check for focal motor seizures, and you want to keep an eye out for a brain bleed, which is basically for a brain bleed, you'd be looking for signs and symptoms of a stroke. And with that, we are done with acute peripheral vascular insufficiency. I hope you found this video helpful. If you did, please like, subscribe, and share, and I will see you in the next video. Bye bye now.